responsible for leading the National TB and Leprosy Program in the Ministry of Health and Child Care in Zimbabwe, a position he has held for over 10 years. Dr. Charles has overseen the growth of the NTP and is actively involved in operations research. He is passionate about scaling up accessibility and quality of services that children with TB receive, working closely with several partners, including the Global Fund, the Union, and EGPAF. He has spearheaded several initiatives for childhood TB, including the adaptation of the Union's Just Guide for Childhood TB, involvement of community volunteers in TB case finding, capacitation of healthcare workers in specimen collection techniques such as gastric lavage and sputum induction, and recently the use of gene expert for TB diagnosis in stool specimen for under 5s. Through his leadership, more than 50% of the country now has a digital X-ray from the NTP, and this helps a lot in improving childhood TB diagnosis. I also want to hand over to Grania to introduce herself briefly, and then she will introduce our first speaker for today's webinar. Over to you, Grania.
No problem. Hello, everyone. I'm going to temporarily turn on my camera just so you can see me. Welcome to today's webinar. I'm the director of the TB department at the Union. So thank you, and thank you, John Paul, for the introduction. So just as a background, we know that ending TB by 2030 requires country to establish the mechanisms through which commitments made at the 2018 TB UN high-level meeting will be implemented and the targets achieved within this set timeframe. The WHO roadmap launched at the UN HLM meeting. This roadmap towards ending TB in children and adolescents provides guidance on the need to have functioning technical working groups and a framework through which countries can address child and adolescent TB in line with these global commitments. Strengthening focal points and expanding technical working groups for child and adolescent TB within national TB control programs, and ensuring the appropriate representation of relevant stakeholders within these groups is one of the key actions to help foster local expertise, national leadership, and accountability for the management of child and adolescent TB care and prevention. In today's webinars, we will focus on sharing best practices for national child and adolescent TB technical working groups, from their establishment to maintaining and growing them to contribute effectively to the national child and adolescent TB response. Specifically, we will discuss the WHO guidance for an effective technical working group. We are very lucky to be joined and have representatives from Tanzania and Mozambique sharing their best practices and challenges for a child and adolescent TB technical working group. After our presentations today, we really hope that we will be able to discuss and share experiences and perspectives from all of our Centre of Excellent member countries who've been able to join today. So I'm now going to hand over to Dr. Sandy to introduce our first speaker. Dr. Sandy.
Thank you very much, Tanya, for the initial introduction. I'm going to introduce our first speaker today. It's Dr. Chishala Chabala, who is a pediatrician and a lecturer at the University of Zambia School of Medicine. He's an investigator on multinational collaborative pediatric clinical trials on tuberculosis, HIV treatment, and pneumonia, as well as being a member of the WHO Child and Adolescent TB Working Group. As he has also previously participated on pediatric national TB program reviews in several countries. He has actually been also to Zimbabwe on that type of mission. He has provided technical input in the development of the National TB Strategic Plan, treatment guidelines, and training materials for adults and children in Zambia. So Dr. Chishala Chabala today will be presenting on the WHO guidance for an effective technical working group. Over to you, Dr. Chabala. You have the floor.
Thank you, Dr. Sandy. And thank you for this opportunity to share with you some of ways that we can have effective working groups within our member countries. So I'm not sure whether I'm able to advance my slide from my end, or somebody will do that for me.
I think if you just say next, John Paul will be able to advance.
Okay, so let me have the next slide. Yeah, so just to remind ourselves about where we are in terms of pediatric TB at the present moment. So we have, according to the 2020 report, we have an estimated 1.2 million child TB cases every year, representing about just 12% of the global TB burden. We have an estimated 230,000 deaths. And just less than 500,000 have been able to access preventive therapy, representing 27% of the children who are eligible for preventive therapy. Next slide. And we have significant case detection and prevention gaps. So if you look at children who are below the age of 5 years, almost 2/3 of them are either undiagnosed or unreported. And then if you go to the age group of 5 to 14, that's just about half. And then if you compare adults and children, taking children below 15 years, you find that just over half of the children are not reported compared to a quarter in adults. And like I mentioned, 2/3 are not assessing preventive therapy, even though we know that pediatric TB is potentially preventable if you can identify a child who's been exposed to TB and provide preventive therapy. Next slide. So significant progress has been made over the years in the last decade, starting from the first call to action in 2011 up to where we are now in 2010. And initially the focus was over the first few years in this timeline was to get proper estimates of what is the actual burden of TB. And now we've come to a point where we are getting nations reporting to the WHO, and we have every year we have pediatric TB data flowing, and in 2020 now we have some major aggregated data together with data on outcomes and also on drug-resistant TB. There have been some significant milestones, including the first in 2012 of STEP TB, which was followed by the development of the roadmap, which basically provided a vision of having 0 TB dates. And in between, we've also had in 2015 the introduction of the pediatric TB formulations that aim to improve the treatment of TB in children. And in 2018, we have the roadmap, which is now providing us the guidance on how we are going to reach the end TB goals for pediatric TB. Next slide. So the roadmap has some key action points that are needed to achieve these goals. And these include strengthening advocacy at all levels, fostering national leadership and accountability, and I'll probably focus on this because it's the one that speaks to the technical working groups, which is the topic for today. Then fostering functional partnerships for change, making sure that there's increased funding for child and adolescent TB programs, and then bridging the policy practice gaps, ensuring that we have expanded and implemented interventions for prevention, and scaling up case finding and treatment, and ensuring that we have family-centered and community-centered strategies. We also need accurate data and accurate reporting, so this can be used for programmatic implementation. And we also need to encourage child and adolescent TB. Next slide. And so the roadmap basically gives us a vision on where we are starting from and going to the target of the 2030 NTB targets. And these key action points actually are required to be implemented simultaneously or along the way so that we can get to this target of ending TB. Next slide. So when we look at the working groups, so the role of the working groups is actually stipulated in the action point number 2, which says foster national leadership and accountability. And this targets policymakers, national district level program managers, civil society, and communities. Next slide. And this key action point actually has a specific, this particular point has specific points that we need to do. And I've highlighted the one that speaks to technical working group, which is strengthen focal points and expand working groups for child and adolescent TB within NTPs that include your stakeholders. There are several other points that the technical working group can contribute to, including the building institutional capacity, strategic planning for coordination and for case detection, prevention and treatment. Then ensuring that children get TB services free of charge, providing support, social support to vulnerable families, and engaging civil society. Next slide. So how can we basically know that we are doing the right thing with regard to the roles of the technical working group? So we can use the framework which is provided by the WHO, which stipulates framework for conducting national review programs, which looks at different aspects that are needed for successful implementation of a TB program. And these are now nicely captured in the benchmarking tool, which was developed by the KNCV, and it captures all the different elements that national programs can use and also technical working groups can use for self-assessment. So I'll just briefly go into detail what the benchmarking tool talks about in the next slide. So like I said, this benchmarking tool was developed by the KNCV, and it is designed for self-assessment. So country programs can use it to assess where they are with regard to the TB implementation in children. And it helps identify gaps and areas that need to be addressed for successful implementation. It's not a reporting tool, and it is not required for any reporting mechanism. And like I mentioned earlier, it's based on the WHO framework for assessing child TB activities. Next slide. So these are some of the elements of the benchmarking tool. So it basically talks about political commitment and stakeholder coordination, and the role of the working group actually is captured in this area. So it talks about strategic technical strategies and approaches, access to TB diagnostic and prevention services, and the outlines of an action plan. And it's got 12 standards, and each of the standards has an associated benchmark, and it also has some indicators that can be collected to assess these parameters. Next slide. And this is just an example of some of the elements that I've captured. And here I've just put the standards on political commitment, prevention, and diagnosis. And it actually stipulates the benchmark under which one of these. And then if you look at the results column, it tells you whether this benchmark has been met, partially met, and not met. And then it describes exactly what the status of the benchmarks of the results that have been identified. And after that, there is a second column then that is availed for you to provide steps that you're going to take to address these the missing areas. Next slide. So if we look specifically at the standard that is addressing the issues relating to child TB coordination and stakeholder engagement, under which the working groups fall. So he talks about, is there a technical working group with wider representation, and does it have terms of reference? The technical working groups, does it meet, and do they have work plans? Is there a child focal point person within the NTPs, and do the working groups have implementation plans? Do the country programs have implementation plans? Next slide. And then this is the standard that addresses the working groups. So the benchmarks under this standard include, is there a national child TB working group, and in this working group, is there representation from all stakeholders, especially maternal child health services, national pediatric associations or equivalent bodies, relevant NGOs and NTPs? Does the working group have clear terms of references? Does the working group have planned meetings and action plans? And does the working group actively monitor and follow up on the implementation and action plans? Is there an NTP focal point for childhood tuberculosis? And if there's a focal point, is the focal point familiar with the WHO recommended policies for the management of tuberculosis? And so countries can assess how they are performing in each one of these benchmarks. Next slide. And again, this is just again an excerpt from the benchmarking tool, that when you've looked at this, you can then describe what the current situations are pertaining to each one of those benchmarks. And then you make a conclusion whether it's met, partially met, or not met at all. And then you then formulate steps on how we are going to address these gaps, and by whom and when you hope to each. And then you can then make a plan on how, of making this review again to see how well the activities are being implemented. Next slide. And so this is just some of the terms of references that the technical working group. I think the goal should be aligned to the goals of the roadmap for ending TB in pediatrics. So it should include promoting policy development, formulation, and implementation of guidelines, health worker capacity building, and stakeholder participation to achieve the goal of ending child and adolescent TB. Next slide. And these are some of the functions that the technical working group should aim to achieve in order to align itself to the roadmap. So it should foster national leadership on child and adolescent TB, advocate for inclusion of the needs of children and adolescents in research, policy development, and clinical practices in line with the child TB roadmap, contribute to the development of evidence-based guidance and tools for the management of child and adolescent TB, provision of input in program strengthening, monitoring, technical support for child TB, and then promoting stakeholder engagement in addressing child and adolescent TB, and also supporting NTPs in strategic planning to ensure that child TB targets are formulated and resources allocated for these activities. Next slide. And these are some of the guidance on how you could go about formulating a functional working group. So the working group should have clearly stipulated goals and objectives, and should have clear terms of references. It should have good structure of composition. Should be well defined with a clear leadership structure and broad membership, which can be tapped from both players at the policy level, public health level, clinical, and civil society organization. And it should also have clearly stipulated membership responsibilities. The working group should have clearly formulated action plans and how these are going to be implemented. And it should also have plans for monitoring the activities of the working group. And that's where the benchmarking tool that I mentioned could be clearly handy in monitoring these activities. It should also have a secretariat and a focal point within the NTP, because all these activities are being done in line with the country programs, and so therefore it should have a very intimate link with the national TB program. Next slide. And just coming back to the roadmap again, we will not see that actually for us to attain all the 10 key action points to end tuberculosis in children and adolescents, the leadership is actually required. So the roles of the technical working groups together with the country program leadership is actually cardinal in this journey to reach the target of ending tuberculosis. Next slide, please. So just basically come to my end, and just to acknowledge the Child and Adolescent TB Working Group, the Union, the CDC Global TB branch, and also Animieke and Sabina from the WHO Global TB Program. Thank you.
Thank you very much. Thank you very much, Dr. Chubala. I just see that Jean-Louis may have joined the call. Are you able to hear us, or because I think you were having network connections?
I can hear you. I can hear you. I just followed the Tanzanian experience, and wanted to have the impact of this working group on the data, but I'm hearing you.
Great. Okay. So maybe in the interest of time, we'll just welcome. So our next speaker is Dr. Hassan Mataka. Dr. Mataka is a medical specialist and the National Childhood and Adolescent TB Coordinator at the National TB and Leprosy Program, Ministry of Health, Community Development, Gender, Elderly and Children in Dodoma, Tanzania. Currently, he serves as a technical working group member of the Childhood TB, TB in the Mines and Monitoring Evaluation at the national level. Dr. Mataka did serve as M&E manager at the Global Fund at the Ministry of Finance from 2014 to 2018, and was the district medical officer in 2 districts, Mbule, and apologies for my pronunciation, and Ukawe, between 2010 and 2013. Dr. Mataka will be presenting on the best practices and challenges for a child and adolescent TB technical working group, lessons learned from Tanzania. Dr. Mataka, over to you.
Thank you so much. I will present on childhood TB technical working group with Tanzanian experience. Next slide. Yeah, my presentation will be on the profile of the TWG, establishment, frequency, composition, terms of reference, expected deliverables, roles and responsibilities, achievements and impact, challenges for establishing, maintaining and coordination, and ongoing processes. Next. Yeah, in Tanzania, we have about 8,000 facilities, and we have 26 regions, but the population is 56 million and 31 administrative regions. But with TB, we have other TB regions, which are more than 26 regions. Next. Yes, next slide, I've already explained that. All right, establishment of technical working group was done on June 2018, and it was after a consultative process between National TB and Leprosy and the Maternal and Child Health section of the Ministry of Health. And the purpose was to provide a strategic direction to the leadership to accelerate country progress toward reduction of the burden of childhood TB in line with the global roadmap of target of zero TB infection, zero suffering, and zero death due to disease among the children in Tanzania. And it is biannual with the frequency, and we have done 4th TB technical working group meetings. The last one was at July 2020. The first was the second quarter of the 2018, and 2 were done on the 2019. Next. And that was the 3rd meeting. The picture shows our meeting was done in Dodoma, or the said meeting. And the composition of the member, we have a government member from National TB and Repros, Reproductive, Child and Health and Section in the Ministry of Health, National AIDS Control Program, Medical Stores Department in President Office, Regional Administrative and the Local Government Ministry. And then we have developing partners who we include WHO, we have UNICEF as the composition member, USAID, and we have non-governmental organizations which work with the childhood issues, including EGPAF, AMREF, MSH, URC, and KNCL.
No.
Hello, do you hear me?
Yes, please go ahead.
Okay, and we have a private facilities regulatory authority, which we call AFTA, and then we have a professional association, which is the Pediatric Association of Tanzania. In the academia, we have 2 universities, Muhimbili University of Health and the Allied Services, pediatricians, and University of Dodoma, pediatricians. And we have regulatory bodies, which is Tanzania Medical and Dental Authorities, and the TFNC, which is Tanzania Food and Nutrition Commission. And we have community actors and inputers who deal with the TB cases in the community. Next. The terms of reference include to coordinate the childhood TB stakeholders, to achieve effective implementation of childhood TB intervention, to contribute on the screening and diagnosis of more children and put them on effective treatment, and reduce TB-related death in the country. Next. Expected deliverable to all the technical working group members is, first of all, having evidence-based intervention and the best practices for childhood TB scale-up in other areas. And then we have a recommendation for implementation, monitoring, and evaluation of childhood TB intervention, resource for childhood TB intervention increase as a deliverable expected, and the services for childhood TB integrated into other parts like reproductive child health sections and CTC services, OPD and IPD. Next. So the roles and responsibilities of the TWG members, first of all, is attending the scheduled Child TB Technical Working Group meeting and nominating proxy member to attend if necessary. Share all the communication and information across the partnership advisory group members. Notifying members of the group as soon as practical if the matter arises which can be deemed to affect the development of the partnership. Wholeheartedly champion of the partnership within and outside the workplace. Make timely decision and take action so as to not hold up the project. Provide a report to the Disease Prevention and Control Technical Working Group with the SWAP group. Next. Achievements so far and the impact of establishing, maintaining, and coordinating the TWG, integration of the TB module in the IMCI. Then our national IMCI, we integrate the TB module, and very specific, including childhood TB in the distance learning IMCI, which most of it improve the capacity, it makes the capacity building of the health workers in diagnosis the TB in childhood. The other thing is that in the DMCI, we did a pilot for 4 regions, and now we are planning to scale up to other regions in the Global Fund grant. Then we have in-depth of trendy pediatric and adolescent data analysis. We've done an in-depth analysis through Pediatric and Adolescent Epidemiological Review 2019. And the advice on the need to generate local evidence, the TWG advised the ministry the need of developing local evidence on TB-LAM, stool for gene expert, assessing acceptability and the feasibility of the shorter regimens approved by the WHO for eligible groups. Next. Challenges for establishing, maintaining, and coordinating, first of all, was the competing priorities of the members. You know, the TWG had most of the top officials in the different organizations, so sometimes setting meeting time is a bit cumbersome, so based on the priorities available in the country.
Hello?
And a slow uptake of the recommendations. Hello?
Hello?
Hello. And another one is the need for funding to run the meetings. Can be the chat. Next. Yeah, what is ongoing to reinvigorate TWG is to revive the membership. For now, we have 55 committed members. So we find that we have to trim up to 35 members so that we can have a very efficient and effective meeting. And then we had an issue of reviewing the TOR and set calendar track changes, monitoring the deliverables and action points, and introduce strategies which may strengthen the uptake of the recommendation and the deliberation timely with the government. Thank you. Next. Thank you so much for listening. Over.
Thank you so much, Dr. Thank you so much, Dr. Hassan Mataka. To everyone participating, please remember you can enter questions for any of our speakers into the chat box at any time during the webinar, and then afterwards we'll have a discussion. So we'll move on to the next speaker, who is Dr. Krimenia Mbate Mutemba. I hope I pronounced it correctly. Dr. Krimenia is a pediatrician, PhD fellow with clinical experience in TB HIV. She has served as a childhood TB specialist in Maputo City for some years. Currently, she is the focal point for childhood TB in the Ministry of Health, Mozambique, in the National TB Program. She also coordinates the Childhood TB Technical Working Group. Dr. Krimenia will be presenting on best practices and challenges for child and adolescent TB Technical Working Group, giving us the lessons learned from Mozambique. Dr. Krimenia, over to you.
Thank you, Chair. Apologize for my bad English because I'm Portuguese speaker, but I will try to present our experience of child with TB Technical Working Group at the NTP. Next slide, please. In this presentation, we will talk about the country profile, the composition and coordinating of Technical Working Group, the terms of reference of the Technical Working Group, the country-based practice and challenges, the impact of the Technical Working Group in our response of childhood and adolescent TB, the lesson learned, and ongoing process. Next slide, please. So Mozambique is located in Southeast Africa. We are about 30 million of population. The PTB incidence is 361 per 100,000 population. The mortality in 2019 was 11,000 deaths. HIV prevalence is 13% according to our national survey. The TB HIV co-infection rate was 36% and the treatment successful rate was 93%. So the childhood TB represents 18% of all cases notified in the country. Next slide, please. So our technical working group was established in 2013. It is a multidisciplinary technical working group composed by nearly 30 members from NTP, Maternal Child Health Program, Nutritional Department, HIV Program. We have pediatrician from the Pediatric Association and partners and NGOs. The chair is NTP, normally the childhood focal point, and we meet, the meeting taking place is monthly, and according our annual plan, we can meet weekly or according our necessity. Next slide, please. So the terms of reference of the technical working group is to develop policies and guidelines about childhood TB, promote and support the implementation of these policies at all levels, develop curriculum and support childhood TB training cascade of the healthcare workers, lead and develop research agenda, and mobilize human and financial recourse to address childhood TB. The main goals are improve early TB case detection, decrease childhood TB mortality and mobility, and improve TB prevention. Next slide, please. So would like to share the best practice of establishing this group. The technical working group with the NTP was developed a first national childhood TB guideline in 2013 and updated it in 2019. It also developed a childhood TB training with 18 modules for 5-day training and trained healthcare workers as medical doctors, maternal child health nurses, and other clinicians, and include the pediatrician as trainers at provisional level. This group are included to oversight visit and technical assistance about TB and develop IEC materials as poster, job aids, and flyers for community. Next slide, please. In this slide, we would like to share that before the technical working group, our TB, childhood TB case notification was under 10% of all TB cases in the country. But when we created the childhood TB technical working group, this group improved and organized the TB service and integrating the TB screening at all entry points, and it culminated with the growing trends of our TB cases notification. Now the childhood TB in Mozambique represents 13% of all cases notified in the country. Next slide, please. So as case finding, we are using simplified algorithm for clinical TB diagnosis in children. The group was advocated to integration of TB screening and diagnosis into maternal child health, pediatric, inpatient and outpatient, and HIV care and treatment service. We are also using lay people for rapid identification of presumptive TB in the health facility waiting room and refer this patient for clinical evaluation. Next slide, please. At the community level, we are using the community health workers, which were trained using the training material developed of with the technical working group to conduct household contact tracing and referral pediatric eligible patients for initiation TPT or curative treatment. We are also using GeneXpert as the first line test to diagnose TB, including in children, using the induced sputum when it's possible, and gastric aspirate for the young children. Next slide, please. So we have a challenge. The main challenge to coordinate this group is the overlap of the member agendas. So sometimes it's difficult to find the date for the meetings, and we have considerable membership change when we have a turnover of the members of the partners and the NGOs. Next slide, please. So we think that all stakeholders need to be included in the process of the establishing and maintaining the technical working group for assessment, planning, implementation, and evaluation to achieve consensus and required commitment, including pediatric association is a key to provide a valuable expertise for the country. The TB training are key to sustain the healthcare worker confidence and child TB diagnosis and management. Next slide, please. So now we are in revigorating this group. We would like to strengthen the coordination of child TB activity at subnational level, expanding the creation of child TB technical working group at the provincial level. Next slide, please. Thank you for your attention.
Thank you very much. That was a very interesting presentation. I'm just actually, we are now at the discussion phase of our meeting today. And so please, if you have any questions for any of our speakers, now is the chance to ask them, and as well as sharing some of your experiences of how your technical working groups have been established, or if they have been established, any areas that work well or success stories that you would like to share with the group, as well as challenges that you would like to share. So the floor is now open. You can use the hand raise function on the platform, and if you're unsure where that is, if you go to the participants section on the screen, and if you click that, you will be able to see how you can raise your hands. And unfortunately, I do just have to say I have to drop off for another meeting. So Dr. Sandy and John Paul, with the support from the other union and CDC colleagues, will support this discussion section, and I will still appear because I am recording the call for those who are unable to join today. So Dr. Sandy, maybe do you want to start by, or Steve, would you like to unmute and ask your question?
Yes, certainly, Grania. Greetings to everyone. It's Steve Graham from Melbourne in Australia. I really had quite a specific question, but thanks very much to everybody for excellent presentations. My specific question was to Mozambique presentation. What I thought was quite impressive increased case detection over time, whether that represented increased numbers over time, whether that represented improved case detection or improved case notification or reporting to the program, or both, and whether it included children under 5, and what do you think were the reasons why there has been such an increase over time? What were the interventions, I guess, that led to that increase? So a few questions, I'm sorry, but it'd be nice to get some reflection on that. Thank you.
Thank you. Thank you very much, Steve, for that question. I hope Mozambique, you managed to capture it well. As you are answering it, perhaps you could also share what was there any indication of the treatment coverage in children from the recently concluded TB prevalence survey that I think Mozambique undertook. Perhaps you could try to address those comments from Steve and myself.
Thank you for the comments and questions. We think both was helped us to improve our TB case notification in children. When we start to training healthcare workers and using the simplified algorithm to identify fastly the presented TB cases, we think the healthcare workers will be more confident to diagnose TB in children. We still have a challenge in some regions, and especially in children under five years. Now the children under 5 represents 32% of our notification in children, and we have more notification in children more than 5 years. I didn't understand the second comment. Can you repeat, please?
Yeah, sorry. Thanks, Carminia. What do you think were the main activities over time that really made the difference in terms of increasing case numbers?
We think the first one was to include a target for and specific indicators in our national strategic plan, and develop policies for the healthcare workers to guide identification these childhood these children with TB, and the training was the key for building the confidence for the healthcare workers. And we also strengthen our monitoring and evaluation to better report these numbers of the child notification. Thank you.
Thank you. I think Dr. Sandy also wanted an additional, I'll leave it to Charles. Thank you.
Yes, I don't know if my question was clear. I just wanted to know from your TB prevalence survey if you were able to get some projections of the treatment coverage that you have attained in children, and what are the gaps that you still have for children. I know it might be a bit early because you are still processing the report.
Thank you for the question. Unfortunately, in the case of for treatment cover and outcomes, don't disaggregate it with ages. I'm not able to tell something about it because we have all we evaluate the treatment cover for all ages, not specifically for children. This is a challenge we will discuss, and maybe in future we can be able to share something about it.
Okay, thank you. Are there any other questions to the two presenters? Probably, if there are none, we can actually also find from the other countries on the call what is the progress in terms of setting up a functional pediatric TB or a childhood TB working group. I see we have Zambia. Zambia earlier on shared something on the chat. I'll give the floor to Kevin to highlight the progress in Zambia.
Excuse me, Dr. Sandy. As Kevin responds to that, I'll also put up a few poll questions for the group on the call, so we can be able to capture some information regarding the technical working groups in the specific countries. Thank you. How about you, Kevin?
So thank you for the opportunity to speak on the call. My posting in the chat. Hello?
Yes, I think we lost you. Perhaps you can start again.
Oh, okay. So I was saying that the post I put in the chat was basically responding to the request that John had made, that we do post on our technical working groups that are there. So as Zambia, we do have a national technical working group, which looks at the overall adult, childhood, and adolescent TB. But then we have a sub-pediatric technical working group, I think, which is chaired by the administrators, clinicians, and the NTP sit there. It's represented also by the Zambia Pediatric Association as a representation there. There are several other partners that partner with government and the cooperating partners, like Eradicate TB and PATH, sit on the technical working group. The PATH, CRS, CIDAS, there's JATA as well. They do sit on the technical working group. The unfortunate thing is that we've not had a meeting that focuses only on pediatric, the pediatric technical working group, but the national technical working group meets every last Thursday of the month, and they discuss several policy interventions that need to be done. For instance, currently we are now looking at revising our national strategic plan, and we just finished also revising our treatment guidelines for adult and pediatric TB that we get. So thank you.
Thank you very much, Kevin. Seems like there's quite a lot happening at in different ways according to the country context. Do we have another country apart from Zimbabwe? Yeah. John Paul, do you have another country?
Yes, Dr. Charles. Yeah, so we also have Malawi on the call today, and then and Kenya. So if a colleague from Malawi, I think I saw Christina on the call. Do you want to share anything about how your technical working group is functioning in your country? How about you, Christina?
Hello, John Paul.
Yes, we can hear you. Thank you.
Yeah, unfortunately, I don't have any information. I think next time we'll say something. Thank you very much for giving me a platform to speak.
Okay, thank you, Christina. How about our colleagues from Kenya? I think I know. I saw Christine on the call. Christine, do you want to give us some highlights about your technical working group in your country?
Thank you so much, John Paul. I see Jackie Kisia from Kenya still on the call, and since the NTP is the host for the pediatric TB technical working group, maybe I can give her a chance to say something. Over to you, Jackie.
Thank you, Christine. So our working group as the pediatric TB committee of experts, that's what we call it. And we have a chair, and the chair is usually one of the partners who are involved in the pediatric who are more involved in the pediatric activities. And the secretary is usually the TB program, the national TB program. We also have partners, WHO. At the moment, we have WHO, USAID representatives, and other partners who are involved in pediatric activities. Also, in the national program, we have a representative from units like DRTB, also PPM, public-private mix. We have partners, the sister partners of the government, that is Child Health, is also one of our representative. We also have the academias, the Nairobi University representatives, and we are governed by some terms, around 10 of them. I was not so ready for this meeting, so maybe I can present the 10 terms which we have in the pediatric committee of experts. I think we'll hand over back to you, or if my head of program want to comment, Dr. Elizabeth is also in this meeting. Thank you.
Yes, good afternoon, and thank you also, Dr. Jackie, and thank you, the conveners of the meeting. My name is Dr. Elizabeth, NTP manager for Kenya. As Jackie has said, yes, we do have our pediatric TWG. Previously, we were restricting to the under 15, but I think the group is thinking of expanding so that we look at the ages up to, is it 17? I'm not really 19. Sure which 19 up to yeah, it's up to 19. So what happens, as Jackie has said, we have terms of reference for this committee of experts. It's actually synonymous with the TWG, with the representations from the various stakeholders. And part of it, they meet on a quarterly basis. But again, the TWG also has subcommittees, which, if given time, Jack will be able to present to you in the next meeting the various subcommittees of the TWG. And this TWG, the pediatric TWG, they come up the laboratory or RU can be given the detail, but some of the recommendations that they come up with have to be presented to another higher governance structure. We call it the TB Health Sector Working Group, so that it's at that level where the endorsement is done for many of the recommendations and that they propose. So that one we can share with you in the next meeting, so that we can learn from each other. I don't know whether there's something else you may need to know, then I could explain. Yes, how do we fund the TWG? You know, during this COVID period, the meetings are virtual, so we don't really give yeah, right now we are conducting them virtually, but previously we've been cooperating the support. It's like tea and lunches when we used to have the physical meetings, and just tea and lunch, and we include them in our GF grant support. And sometimes other partners can come in to support, maybe convening a physical meeting and having just lunch and teas. Over and out.
Okay, thank you very much, Dr. Elizabeth, for sharing the Kenyan experience. I think from Zimbabwe, or we still have Malawi. Do we have Malawi before I give Zimbabwe? Okay, so perhaps I'll give the Zimbabwean experience. We established ours in 2018. It meets quarterly. It's composed mainly of the Ministry of Health and local partners, as well as the implementation level and civil society. So its main role is to actually provide advice to the National TB Program, which is of course the Ministry of Health. And I think I have learned a lot from what Mozambique has done, and we'll then take it. I think we could also take it offline with other countries when you feel you can desire some more details, because I think we have a lot to learn. I'm quite impressed about the way that Mozambique has progressed from 4% to 13%, and we are currently at 5%, so I'm sure we can adapt some of the Mozambican lessons. So that's just a summary of the sharing of lessons. I don't know if there's anybody who has another issue to raise with different countries that have shared their lessons, or with the presenters.
I think, Charles, there was a common question on the chat box about who is funding most of the work for the technical working group. So it will actually be very good for us to actually also get your perspective in Zimbabwe, who funds this, and then also any other country really sharing with us who is funding their different technical working groups. I know that Kenya has said most of this is really funded by a global fund, but it's good for us to get to know what is happening in the different countries and who is funding this. Over to you.
Well, from Zimbabwe, the funding has benefited from COVID in a way. We used to have a headache when it came to funding. Initially, it was funded by Clinton HIV, Clinton Health Access Initiative, CHAI. And then when that funding ran out, we had a headache now to get money. And then COVID came in. Now we are doing it virtually, and it's almost as effective. I think the funding was mainly required, especially for those who will be coming outside the capital city, if they were to come to travel costs to come to Harare. I don't know if the other countries can also highlight how they have managed their funding, those who haven't indicated. I think Tanzania said something, and Mozambique said something about funding.
Kevin, do you want to say something about Zambia? I think we've lost. I think we've lost Kevin. But also we have some poll
Sorry,
questions running.
Unfortunately, I can't comment on the issue of funding and all, but most of our funding, I can't comment on the nitty-gritties, but most of the funding is either through Global Fund. The Ministry of Health itself has increased the amount of money that they put towards the budget into the TB program. There's Global Fund that is partnering with USAID and other cooperative partners.
Okay, thank you, Kevin. I was just saying that we still have some poll questions running. There's one that is just about to close. So I think we have 1 or 2 countries that have not been able to respond. Please do so that we're able to show you the results of these poll questions. There's a comment, probably a question or comment from Jean Lois Abena-Fowe. I think it's a question, yes. The question is, how often are the technical working groups evaluated in different countries? How often do we sit to evaluate the work of the technical working groups? I'm happy to really run through the different countries just to really tell us how often this is being done. Could we start with Kenya? If you're happy to just say 1 or 2 words. Over. Hello, Dr. Kisia. Are you there?
Yeah, I'm here.
Dr. Elizabeth.
By the way, I'm not sure we've even evaluated our TWG. Do we even have an evaluation tool for that?
Okay.
I haven't seen one. So.
Dr. Jackie, you have something to say?
No, I haven't seen an evaluation tool. And I think my short stay in TB, I wouldn't be in that position to, unless now that we know there is a tool which is supposed to be developed. We develop a tool during the COE and evaluate after a certain period of time.
Okay, thank you.
Hello.
Yes, please. Yes, Hassan.
Yes, Tanzania. Hello. Tanzania evaluation was based on the 5 years strategic plan evaluation. So when we are doing by the mid review of strategic plan and the end review of strategic plan, we include the program technical working groups to review. Thank you.
Okay, thank you. Any comments from Malawi and Mozambique?
Thank you. In Mozambique, I didn't see the evaluation. I think we don't have a specific tools to evaluate the technical working group. Thank you.
Yep. Okay, and then I think our last country is, Dr. Sandy, how about yourself in Zimbabwe? How often do you evaluate the functionality of the technical working group?
Yeah, actually, it's a very good question, which we probably don't think much of when we have these technical working groups. How do we evaluate their effectiveness? I'm sure most of our country technical working groups just run and run, but it's something that we should be incorporating in the terms of reference and implementing more seriously so that it can improve. We hadn't done any evaluation, but I think we can build it in terms of reference, not only for this one, but for others.
Thank you, Dr. Sandy. I have also posted our last poll question to the group, so please feel free to also complete that so we can also capture that. But there is a comment from Susan Maloney, and she says she's curious to know how our technical working groups are functioning in the virtual environment. What has been the experience? colleagues on the call, are you able to tell us a bit how the virtual environment and COVID has affected functionality of your technical working groups in your respective countries? Over.
Hello. So, like for Zambia, the National Technical Group has had to adapt and move to the virtual meetings that have been on. It's actually created some kind of a positive on it, in that sometimes most people are able to attend these meetings because they're now virtual and people can attend even if they're out of the station and out of the country. So those are some of the benefits. But as usual, sometimes people are not on the meeting. They've joined the course, so it creates a bit of challenges because of the multiple online meetings that have occurred. Most of the meetings we've had for the last 6 months have actually been virtual, if not all. Thank you.
Thank you, Kevin. Dr. Hassan and Dr. Zuwaina from Tanzania, do you want to say a word or two? Hello, Dr. Hassan.
Hello, please.
Yes, we can hear you.
Can you tell me what was the question?
Well, the question was, how has the COVID situation, the bit that now most of work is being done virtually, how has this affected functionality of your technical working group in your country? Over.
Although in our country, the technical working group was actually disturbed in the April up to July. Then from there, as our government, we are allowed to work with the situation of the COVID. So everything back to normal. So there is nothing changes after that. Yeah, thank you.
Yeah, thank you. Any other countries would love to share something about how this has affected work in their different countries?
Okay, for Kenya.
Yes, I think there's.
I'm sorry.
Yes, please go ahead.
Okay, for Kenya, we have moved to the virtual meetings. The only issue sometimes, like when you want to hold a meeting and the participants are not so suitable to the time you have set, so it becomes a bit difficult. Sometimes you have to go on with the meeting, but then you won't get the representation that you really require. And also for virtual meetings, they can't take so long. If there's a discussion, you find people dropping off or having to leave the meeting because they need to join another virtual meeting. And also sometimes you find people just log in for the sake of being in the meeting, but they are not actually attentive or contributing much because they are doing something else. Either they're at home, either they're cooking, or so they won't give the seriousness that it deserves, like a physical meeting. But so far, we've been able to hold our quarterly meeting, and we'll work with the situation with the because COVID is here with us, and we have to just adapt the new way of life. Thank you.
Thank you very much. I think for Zimbabwe, it's there are both pros and cons for virtual meetings, but I think the pros outweigh the cons in my view. As much as possible, I think that is the best way to do business. Of course, noting that they have to choose your method according to the suitability of it for the topic under discussion and the participants, as well as the duration of the talk. Dr. Shishala, you had your hand up. Now,
Yes, I just posted the question I had in the chat. I was just wondering, in terms of evaluating the functions of the TWGs, whether that whether people think that that benchmarking tool that I shared earlier on could be something that could be useful in terms of evaluating the functions of the TWGs. And also, I think in terms of assessing, probably it happens mostly when countries have their review of the strategic plan, either internally or part of joint reviews with WHO, because part of that assessment includes evaluating the functions of technical working groups and coordination of the TB program in general.
Dr. Sandy, do you, in the interest of time, I think we're almost getting to the 1.5 hour mark. Do you want to make some closing remarks and then invite Dr. Susan Maloney to also give us closing remarks? Over.
Okay, thank you, John. Very sorry that we have reached the end of our session. I think there were still a lot of issues that we could have discussed. But for the sake of time, we need to end it here now. But I hope, and we together with the other chairs, that the discussion has been helpful for those who may have been facing challenges of establishing or maintaining and coordinating a child and adolescent technical group. So on that note, I would now like to welcome the Chief of CDC's Global TB Program, who is part of the Center of Excellence's Advisory Committee, to give us closing remarks for this webinar. Over to you, Susan.
Yes, hi, thank you, Dr. Sandy. And hi, everyone, this is Susan Maloney from the US CDC. I'm sorry my video is not working right now. I wanted to just thank everyone for this really thoughtful and useful discussions around your TWGs. I know I certainly have learned a lot, and I really see a lot of opportunity for sharing and for learning between the different countries. And I hope this will continue. In terms of next steps, I just would like to say that hopefully we can, since we didn't have time today, we can share the answers to the polling questions with the group on one of our next calls or meetings, and perhaps invite Kenya to give us a more detailed discussion as they had offered around their TWG and the experiences they have had. And I think one of the things that is ripe for discussion, and that we were doing in the chat as well, is for us to think about together, perhaps how to develop a tool that would be useful for evaluating the impact of our technical working groups, since what doesn't get measured doesn't really happen, as some would say here at CDC. So I think it behooves us all to be thinking about this, and there's been some great discussions. And I believe even one of the groups, one of the countries has already evaluated their technical working group. So I hope we'll get to talk about that in the future. So with that, I will say, I will end our webinar for today. Thank you again for your participation, for all of your commitment to child and adolescent TB, and look forward to speaking to you all again soon. Over.
Thank you so much, Dr. Susan. Also, just a few words from myself. Really thank everyone for really making it to this webinar. I also want to speak a bit about Dr. Jean Lois. I know he joined the call late because of connection issues, but Dr. Jean Lois is a pediatrician. He's a physician. He's a public health physician from Cameroon, and a former TB control program within Cameroon. He has over 15 years of experience working with several African countries. We had invited him to co-chair, but because of connectivity issues, we've not been able to allow him to speak. But I'm sure that in the in the coming discussions we'll be having, especially that he's from the Afro office, we'll definitely be able to have him with us in the subsequent calls. But I also want to thank Dr. Charles Sandy, Dr. Shabala, Dr. Hassan Mataka, Dr. Kremenia, and to thank everyone really who has been able to attend this webinar. In the following few days, we'll definitely share with you an email with a survey on this particular session. But as Susan says, I think it will be very good for us to share these poll questions and be able to get concrete answers from the different countries. We'll also be able to share with everyone else who hasn't been able to attend this webinar a link to this webinar, so they're able to listen to it and probably provide any other follow-up feedback after this webinar. So on behalf of the union, partners at CDC, and all our presenters, thank you for joining us today, and enjoy the rest of the day. Thank you. Bye-bye.
Bye. Thank you.
Bye-bye.
Bye, everyone.
Thank you. Bye.
Thank you. Bye.
Thank you. Bye-bye.
Thank you.
Kwa sababu huu ndio unaoanza na hapa ndipo tunapoanza, basi tuanze kwa kudevelop, alafu ndio nani. I think hii point pia ilikuwa kwa elimu. Naona timu yangu imeshakamilika. So kwa upande wangu mimi niseme kwamba pointi kubwa ambayo sisi tulitengeneza kwenye hii advocacy, kwenye ile timu na timu ambayo ilikuwa inategemewa kuchukua hii component,